The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today I'm delighted to have Dr. Zeno Charles Marcel with us. Welcome, Doctor.
Thank you very much, Don.
Now, I know that you're a doctor of internal medicine, which means that you just treat diseases not with surgical means, but you're a medical doctor. You've worked in ICUs, CCU, all different types of intensive situations.
Yes.
But now you're kind of focusing more on preventive medicine.
Yes, on lifestyle approaches to treating diseases and preventing diseases.
Well, what are some of the things that you see a lot of?
We see a lot of people with diabetes, heart disease, high blood pressure, people who are overweight and challenged by that, people with arthritis. But most of our focus at the Lifestyle Center is on the first four things that I mentioned, the diabetes in particular, along with heart disease, high blood pressure, and overweight. Okay.
If you're interested in getting in touch with the Lifestyle Center of America or with Dr. Zeno Charles Marcel, the others on the staff there, let me give you a web page that you can think of. It's or remember. It's very easy to remember. It's www.lifestylecenter, all one word, .org, lifestylecenter.org. And you can call up most of the information about the center on that, can't you?
Yes.
And then also, you know, people can contact us here at 3ABN and we can let them know how to get in touch with you. We want to talk today about what you've entitled Sweet Blood Sour Deal. What's that all about?
Well, a part of the problem with diabetes is that if you were to taste the blood or the urine of somebody with high blood sugar, hyperglycemia, it would be sweet. It would be sweeter than it should be. However,
I don't think we want to taste their
blood.
No,
we're not going to do that.
Didn't they used to taste their urine?
Used to taste urine in the past, that's correct.
See, doctors' jobs have gotten a lot easier, haven't they?
I would say so in that respect. At least a little bit more sanitary, right?
Okay, so with diabetes, then there's too much sugar then being spilled into the urine and too much in the blood.
Too much sugar in the blood. And this is a sour deal because it affects just about every organ and every system in the body.
Let's just define then. We've kind of defined it already, but what exactly is diabetes? What does that mean?
Well, the old term diabetes came into existence because, first and foremost, diabetes means siphon. Mellitus, the whole word is diabetes mellitus. Mellitus means honey-like, okay? So it was because the urine was sweet and because the bees would go after urine from people who had diabetes, it got that name. Siphon, of course, because the person would eat and drink more than usual, and they would go to the bathroom, they'd urinate much more than usual as well. So it was as if things were coming in and passing out like a siphon.
Polydipsia, polyuria, and polyphagia.
Yes, those are the Greek terms, if you will, right?
Okay, so diabetes then. Are people really familiar with what it is since it's a big killer in America?
Well, you know, interestingly, we have some people who are very knowledgeable about diabetes, but we have also a large number of people who are very unfamiliar. They don't know very much about it. They're just afraid of it. I had one patient, well, not a patient, actually a person, call up at the center desiring information. And the person insisted that they talk to me about this very important issue. In trying to get at what the person's concern was, she had a good friend who would carpool with them. They'd carpool together. And the friend recently had gotten the diagnosis of diabetes. This lady who was calling had not seen her friend in 6 weeks. She had avoided her for 6 weeks because she was unsure as to whether this diabetes can be passed on to her, whether it was a contagious disease. Now, this is probably the most extreme that question that I've received in a long time. But what it says to me is that there are many people who, even if they have exposure to people or friends or family members with diabetes, may not know very much about it at all.
Right, so it's not an infectious, contagious disease.
It is not.
It's a disease that has to do with what we do. I mean, you could catch some habits that ultimately could lead to it, but it's not something you can get by someone who has it sneezing on you or something like that.
Right. Now, there's not only one kind of diabetes. I ought to put that in here. That there are two major kinds. One we call type 1 and the other one type 2. Type 1 is the kind that is encountered most frequently in folks who are younger, that is less than age 40. It's usually associated with the obligatory use of insulin. Whereas type 2 diabetes tends to be in people who are over age 45 and who at the beginning of their illness at least don't need insulin at all. Many of them are actually producing too much insulin and they're overweight.
Now, what I hear is that with even type 1, there's good news today. I heard recently of a study that says they can go into the pancreas and actually put new cells in there that can produce insulin. Is that true?
That's not exactly the way you described it, but they can harvest cells from cadavers, that's people who have died, take those cells out and inject them into people with type 1 diabetes, and they can set up a new population of insulin-producing cells in that person. And
Still experimental?
Well, it's not really experimental in the sense that we've been doing this kind of thing now for several years. But recently there was a breakthrough, one in the harvesting technique, and the second was that we're now using anti-rejection medications that are not steroids. See, the steroids themselves have a lot of side effects.
I see.
And one of the side effects of the steroids is increasing the blood sugar. So you kind of, we're doing better with regard to the techniques for harvesting, techniques for reimplantation, and techniques and medications for putting the immune system.
So the best thing is to, I mean, we have treatments after it happens, but the best thing by far is to avoid it if at all possible.
If at all possible. And type 2 diabetes is largely a preventable disease. About 95% of the people who have diabetes have type 2 diabetes. There is a genetic component, but the genes appear to just load the gun, so to speak. How we live is what pulls the trigger.
Okay, but what about, like, say, even type 1? Let's say that you're a mother, you're carrying a child. How can you make sure that your children don't get diabetes or have diabetes? Is it a large problem with children, and how can we help them avoid even beginning life with it?
Well, one of the things that we recognize is that there is this genetic component for type 1 diabetes, but there are some factors that predispose a child who has the genetic tendency to get type 1 diabetes. There are some infections from viruses, such as the mumps virus or Coxsackie virus, which is another virus, that these two infections actually have been associated with an increased risk of type 1 diabetes. Additionally, there was one study very recently that showed early vaccinations with hepatitis B vaccine may be associated with development of type 1 diabetes.
So careful about when you get those.
About when you get the vaccination. Additionally, we have the connection between type 1 diabetes and cow's milk consumption. In this association, what we find is that there is epidemiologically, that's if you look at populations, there is an association between the use of cow's milk and the development of type 1 diabetes, and the individuals with the type 1 diabetes seem to have antibodies against one of the cow's milk proteins.
Fights against their own
and
pancreas.
they fight against their own.
So there are things we can do before children are even born, and certainly afterwards in terms of this area of cow's milk and different things.
Yes.
Okay, then let's say, though, we have developed it. Let's say that early on in age someone develops it, and it's type 2 we're talking about now, if that's the case. What can we do? Oh, well, maybe this is the way to put it. What are other risk factors that have to do with diabetes?
Okay. For type 2 diabetes, the risk factors include your age. If you're over 45, you have an increased risk. There you are.
All right. Well, I'm nowhere even near that.
If you're overweight, you have an increased risk.
Okay.
If you have high blood pressure, you have an increased risk. If you have a first-degree family member, that is mother, father, sister, brother, if they have type 2 diabetes, then you have an increased risk of developing type 2
Goes to
diabetes.
uncles and aunts? Not really?
Yes, it does, but that association is less strong than the first-degree family member.
Okay.
Additionally, for a woman, if she had diabetes while she was pregnant, she has increased risk of developing diabetes later on, and the child apparently has an increased risk of developing diabetes during its life.
Gestational diabetes. So
Gestational diabetes for the mother.
okay.
But it doesn't even have to be gestational diabetes per se, in that if the mother, while she was pregnant, when she delivered, the baby was over 9 pounds, she has an increased risk of developing diabetes, and the child probably has an increased risk as well. So the weight of the baby at the time of birth, over 9 pounds, is an indicator that the mother would have increased risk later on.
So mothers shouldn't be out there eating anything they want to eat and feeding their sweet tooth.
That's correct, because if what it means is that they push themselves over the edge, if they had a predilection to developing diabetes in the first place, and the extra weight and other factors push them over the edge such that their blood sugar goes up during pregnancy, well, this would not be a good thing for the mother or for the baby.
Mm-hmm. Mm-hmm. Other risk factors?
Those are about the major ones. People who smoke have an increased risk of insulin resistance. We mentioned being overweight. And, of course, there's some ethnic factors. There's this problem or this process of insulin resistance that our genes and our ethnicity seem to carry. Mm-hmm. The people of Native American descent, or if you have Native American blood, you in this country, you probably have the highest risk of having insulin resistance. But then that is followed by people of Hispanic origin, regardless of what race they might be. And then that's followed by people of African origin. And then Asian Pacific and Asian Islanders, they have the next highest risk, followed by people of European ancestry.
Oh, so this is for insulin resistance. It's not that the body's not making insulin, but that it just can't get in the cell.
Well, the body is making insulin.
Right.
You're right. But you need more insulin to produce the same effect if you're insulin resistant than if you were normal.
Okay, so it does really matter who you are. Now, diabetes, is it a real bad disease? What does it do to your system? What does it do to your body? What does it do to your organs? What does it do to your...
In a nutshell, people with diabetes age a lot faster than someone without diabetes. Mm-hmm. So all of the degenerative processes that you can think of are probably going to be affected by the fact that you have high sugar in your blood.
Why?
And diabetes. Part of it is related to what we call glycosylation end products. Now, I know you're not prepared.
Glycosylation end products. So that I'm going to use that now every time I go out.
The thing is, the sugar attaches to our proteins, and it causes the proteins to not have the same flexibility and the same ability that the proteins otherwise would. That causes premature aging of just about every tissue. Mm-hmm. So if it affects the eyes, for instance, we have an increased risk of what we call retinopathy, or we also have an increased risk of cataract formation by different mechanisms, by the way. And we also have an increased risk of having glaucoma, all of which are related to the fact that you have diabetes. Mm-hmm. It can affect the nervous system. You can end up with peripheral neuropathy, or
where you can't feel things,
where you can't feel
things,
or you have pain in the legs or numbness, tingling. It can affect the feet, the hands. It can affect one side of the body. It can affect the abdomen, as well as it can affect the internal organs, such as the heart and the gastrointestinal tract.
Do anything to your mind?
There is a process that we call diabetic dementia. People who have had poorly controlled blood sugars over a period of time, they can end up with dementing illnesses, much like Alzheimer's disease. Also, in people who are prone to having frequent bouts of hypoglycemia, if the blood sugar stays too low for too long, these individuals can end up with some irreversible brain damage.
We're talking with Dr. Zeno Charles Marcel. We're talking about diabetes. If you have it or know someone that does, you might want to give them a call and have them tune in when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who are able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Zeno Charles Marcel. We've been talking about sweet blood, but a sour deal. But we want to talk about some good news about diabetes now, don't we?
Yes.
How to treat it. You know, you work at the Lifestyle Center of America. You're a specialist in internal medicine, deal with diabetics a lot. You've written papers and done research in the area of Syndrome X. That's the diabetes plus all these other diseases and how they come together to really cause a real bad problem. X marks the spot, kind of a bad problem. But, you know, now that we get into the situation of type 2 diabetes, let's leave type 1 alone for a while. What do you do to treat that where you now are there at the Lifestyle Center? What's your protocol? How can people have hope that have that disease?
Well, you know, the approach that we use at the Lifestyle Center is really an approach that anybody can use at home, physicians can use in their office, or you can apply it in the hospital or lifestyle centers like ours. Okay? So this is not something that's proprietary to us. It's something that's available to anybody to be able to use. We start off looking at first things first. To understand and treat any chronic disease, you need to pay attention to the fact that what you eat, what you do, what you take are all important. Okay? So the eating has to do with food, the doing has to do with physical activity and exercise, taking has to do with everything from supplements to herbs to medications, etc.
The whole picture.
The whole picture. And these things intersect in a very important part. Okay? All of them intersect in the center on who you are. Okay? Because if I were to show you the best diet, the best things to eat, the right quantities, everything like that, and I were to show you the best exercise program, give you all the information, all the equipment and all that stuff, and have a personal trainer with you 24 hours a day, and give you the best herbs, vitamins, minerals, all that stuff, but you don't want to do it, you don't want to take it, you don't want to go along with the program, guess what?
Doesn't matter.
Doesn't matter. It's not going to do you any good.
You can lead a horse to water, but you cannot make him drink. All right.
All right.
Okay.
So basically, people, when they understand that what we're dealing with is changing your lifestyle and have the lifestyle impact the disease and whether you're going to have the complications of the disease, the light bulb goes off and they say, aha, now I understand. Because it's not just like taking a pill to put a Band-Aid over a cut. Okay?
Or a shot to take care of the
To take
problem.
care of it. It's how you live that's going to determine to a large extent, particularly when we find people who are early in the course of their disease or who are at the brink of kind of going over the fence to full-blown diabetes, then these individuals are most able to be helped with their lifestyle, even though everybody with diabetes, including type 1 diabetes, can be helped by changing their lifestyle. Now, a very important component is, of course, the food aspect. Here are some of the issues with regard to food. First and foremost, carbohydrates, despite the hype that we might read from time to time that carbohydrates is a bad thing for people with diabetes and for people with weight problems and so on, this is really not fully the case. While people can be helped by other kinds of dietary programs, having a diet that is rich in fiber-rich carbohydrates, complex carbohydrates, this is actually the mainstay of the treatment of diabetes, and it allows for such things to occur as people taking lots and lots of insulin, large doses of insulin, 100, 200, 300 units of insulin a day, coming down to 0 units of insulin a day with better blood sugar control by just making some little changes in this area.
So complex carbohydrates, what would those be? If I have a choice between apples and apple juice, what should I have?
Well, you should have the whole apple. The way I put it is when it comes to fruits, fruits are good. Some people are more sensitive to one kind of fruit or another. But if you're looking at fruits, concentrated fruits, fruit juices, etc., the rule of thumb is the fruit, the whole fruit, and nothing but the fruit. Okay? That works out best.
The fruit, the whole fruit, nothing but the fruit. Okay, so in other words, because if it's a liquid form or whatever, it drives the
blood sugar up higher,
Okay.
and even if the person responds appropriately and produces a good output of insulin, then they tend to go lower than they should, and the person gets hungry and they want to eat more. See?
Okay.
So the issue of food is a very important one with diabetes. So one issue is, of course, the carbohydrate content. The other major issue is actually the content of fat. If people have a lot of saturated fat in their diet, okay, they are increasing their own resistance to insulin.
How does that work?
How it works is, essentially think of the fat as clogging up the works inside the cell. Now, scientists around the world are actually looking at what these mechanisms are, how does saturated fat actually do this. And we have some exciting lines of inquiry going on. But suffice it to say, most people don't need to know all of the details of how this works. They need to know that sat fat is bad fat.
Sat fat is bad fat.
See how easy that is? Right?
The whole fruit and nothing but the fruit.
Right, the fruit,
and
the whole fruit, and nothing but the fruit.
is bad fat.
That's right.
Okay.
See, simple things.
All right.
Moving along to cholesterol. You see, most people with diabetes end up dying not because of the high blood sugar. They end up dying because of cardiovascular complications. They end up with a heart attack or stroke or some combination of these things.
Because all their arteries and vessels are shot.
Exactly. So we want to be able to prevent some of the complications, some of the vascular complications of diabetes. So we would want to limit the amount of cholesterol and certainly the amount of oxidized cholesterol that the person would get.
But doctor, this sounds no fun. What about all my good foods I like to eat?
Well, we'll have to look at what you're calling good foods, because we have been sold a bill of goods, so to speak. You know, it's that sweet blood, sour deal, right? We've been sold a bill of goods. If you were to ask someone what are the goodies that they eat, they'll tell you all of the things that actually cause a lot of disease and actually produce a lot of suffering in the United States and around the world. We call them goodies. Well, no, really, they should be baddies, all right? These baddies, such as the high sugar, the high saturated fat, the high cholesterol, the rich, calorie-laden, empty foods, well, these things aren't any good for us. Now, does that mean that the way you eat to be healthy needs to be tasteless and joyless? The answer is absolutely not. You know, what we have found at the Lifestyle Center, what people know from just their existence, if the food doesn't look good, if it doesn't taste good, if it doesn't smell good, if it doesn't seem as if it's going to be good,
probably not good.
Probably not good. People aren't going to eat it. Okay? So, a wide variety of fruits, grains, vegetables, legumes, and nuts, well prepared. Okay? Some raw, some cooked, some prepared in various fashions. These things actually present to the individual the best choice in terms of food and nutrition for the treatment of diabetes, for the prevention of diabetes, and also for the prevention of the complications of diabetes.
So, you give them cookbooks, you give them different things that they can use there?
That's correct.
And you show them how to do it?
We show them how to do that. We have cooking school, cooking classes that are conducted 5 days a week while they're there.
What if they can't get there? What if they have...
Well, you know, around the country, various organizations and various people have cooking schools that they might put on either in public buildings or at churches and synagogues around the country that teach people how to prepare meals for people with diabetes. Now, here's the thing. There is no quote-unquote diabetic diet. Really, a person with diabetes needs to have a good diet. And that same good, wholesome diet is actually the same good, wholesome diet for any and everybody.
So there's only one right answer.
That's correct.
And that's foods is grown.
Foods is grown. You see, you have the whole system. It's food. If it doesn't grow on a tree, you have to come up with a better answer, right? The refined foods tend to cause the blood sugar to go higher than the foods that are, you know, the way God made them.
I have a long family history of diabetes in my family, and none in my nuclear family, but my uncles, great uncles, and grandfather, and different things on one side. That family seems to have a lot. Some of my relatives and some others I've met before, they're nothing, they're not out of the ordinary, have actually said, well, I don't even want to know whether or not I have it, and they just don't even, they act like they don't have it, regardless of if they do or don't. Is this a good idea or a plan, or why not?
That's not a good plan. You know what it's like? It's like sitting on the railroad track, hearing someone tell you that at 6:30 there's a speeding train that's going to come down the track. And you look around, it's now 6:25, you say, I don't see anything, I don't hear anything, I'm going to sit here, I'm just going to be here. If it comes, it comes. Now, does that sound like a smart thing to do?
No.
No, because at 6:30, what's going to happen?
Kasplat.
All right. Now, the issue with diabetes, the good news is that diabetes, in large part, can be avoided. So someone who has a risk, a high risk of developing diabetes, really should be paying much more attention to living a more optimal life to avoid the diabetes, avoid the complications, and avoid the needless suffering that they will have because of it. Now, diabetes does not just affect the person. Diabetes affects the family. Many people don't understand this. What they think is, well, I'm the master of my own destiny here. See, I can do whatever I want and everything is fine. But you know, that same person, after they get diabetes and they have the complications, they go blind, who's going to take care of them?
That's right. It could be actually selfishness if they don't take care of it.
That's correct. Similarly, they don't do anything, their blood pressure goes up, so they have diabetes, high blood pressure, they're overweight, they get a stroke, right? It's one thing if you get a stroke and you die. It's another thing if you get a stroke and you live and you're paralyzed and
you
other
lose
people
your
have to take
coconut,
care of
your ability to think. Is there good news at the Lifestyle Center of America? When you treat people, what happens in our last minute?
What we see is their blood sugars come down, their medication use comes down, their insulin oftentimes comes down for type 2 diabetes or goes off completely. We have people whose cholesterols come down, their triglycerides come down, their cardiovascular risk comes down, their joy of living goes up, and they do better, they feel great.
And their family feels better.
Oh, yes.
Great. Well, thank you so much for sharing kind of your approach to that. And I'm sure it sounds like you would have much more to share. Of course, you probably, what do you have, an 18-day program, a 12-day program?
A 19-day program.
A 90-day program, too. And so you could just share and share and share on this, and we're glad that you have that facility and you're sharing in that way. You've been watching Health for a Lifetime. We've been talking to Dr. Zeno Charles Marcel. He's the medical director of the Lifestyle Center of America, and they have a web page by that same name, www.lifestylecenter.org. If you'd like more information about their programs dealing with diabetes or the other common killers in America, or if you'd like information about other health programs or would like to get a copy of this video or other health information here at 3ABN, please give us a call. And we hope that as a result of your call and of this program that you'll have health that truly will last for a lifetime.